excited to be here today on Halloween with a very special guest, Michael Petersen, who is the Chief Executive Officer, Managing Director, and co-founder of Information Mediary Corporation, in short, IMC. And we're going to be talking about a really exciting topic around the GLP-1 space, revolutionizing diabetes care, the last mile of GLP-1 therapy with Information Mediary Corporation. Michael, welcome. I'm excited to talk with you. And
Thank
before
you,
we
Amy.
jump in, could you just give a little more background on yourself?
Right. I'm Michael Petersen. I'm co-founder of Information Mediary. We've been in business since 2001, and we essentially develop digital wrappers for medication for the purpose of logistics and medication adherence tracking, information insights, and therapy support.
Wonderful. And I know we've really enjoyed working with you through HITLAB. And to jump into the topic for today's session, can you share and explain what the last mile of GLP-1 therapy means in the context of diabetes care and why it's crucial for effective patient outcomes?
Sure. So we refer to the last mile, or in our case, even beyond the last mile of GLP-1 therapy, as the final phase in the medication delivery process. The patient at that stage actually takes the drug. So it's beyond the point of where the medication arrives at the front door or the pharmacy or through the supply chain. So we are essentially providing insights, information, and support as to the therapy that the patient is adhering to. And we feel it's crucial because it ensures the efficacy of the treatment, which directly then impacts clinical outcomes, and it helps minimize potential complications associated with, in this case, diabetes, by ensuring that the medications are taken properly and handled properly.
I think that's great because that has been a bit of a blind spot, that period of when the person actually gets the medication delivered to when they actually take it. So I agree, it's a critical point to be able to understand. So how does IMC technology specifically enhance medication adherence for those who are going on and using a GLP-1?
Right. So as I mentioned, our core business is supplying digital wrappers and all the ancillary software and system support and cloud and so on. So we're leveraging smart packaging solutions that can essentially track with little sensors inside the package about how the medications are handled and accessed. So with using these sensors and digital tools that we provide, it can remind patients to take their medications as prescribed and provide at the same time the data back to the healthcare providers, which can help ensure adherence to the prescribed regimens. So this real-time monitoring and feedback loop helps keep patients on track with their therapy. That's the bottom line.
I think that's great because, again, that has been a bit of a blind spot, but with this wonderful technology and the ability to track that real-world, real-time data, it's really revolutionary. I think it's amazing. And, as a part of your offering, can you talk a little bit about Certiscan, which is your adherence platform for clinical trials?
Yeah.
And
so
how does that support this initiative?
Right. So in addition to providing APIs and as we heard previously, codeless integration, which is important to a lot of healthcare providers, so we can link directly into other systems, third-party systems. But in addition to that, we actually have a comprehensive web platform, cloud platform called Certiscan. And that provides all the interactive tools and resources that can educate patients about their therapy. It offers personalized health tips, reminders, and information on managing their condition. It also tracks the production of the original package right from the source up to the time of use, which is the beyond last mile type of discussion we had. And provides all the necessary, support and information and digital data points that are of interest both for the patient and the healthcare provider and the supply chain people that are actually getting the medication to the patient. So this empowering approach basically helps reinforce adherence. And adherence in this case isn't just, did the patient take a pill or did they, take a vial out of a package, but also has the package been handled properly? Has it been stored properly? Has it been left out of the fridge for too long to be effective? So all these things are being tracked and actually analyzed and processed right on the package electronics. So it's not like your traditional, say, a temperature logger where you have a logger and gives you an alarm, then you got to, send the logger back to someplace, or the data has to be analyzed by somebody. No, this one basically can keep track of and process in real time all the relevant information that pertains to that particular package. So really, by informing the patient about the condition of the package, helping the patient remember the right steps, giving them additional access to information and so on, we really feel that we can not only support the concept of the importance of their treatment plan, but also to make sure that the medication is safe and effective.
Yeah, I think that's great because, so many people are kind of left to their own devices once they get the medication. So that additional support and education is critical. And then also this platform supporting the continuation and the ability to make sure everything's being adhered to appropriately in a clinical trial setting really helps to accelerate those trials. So I think it's a great combination of offerings. And has a lot of value across many areas of the healthcare industry. So that's amazing to hear. What types of data does your technology capture, and how can it be used to improve patient care as well as treatment outcomes?
Right. So, like I mentioned, we capture data that essentially is collected right by sensors on the package by itself. So that could be temperature, internal temperature of the goods that are inside the package. At the same time, it tracks when a particular dose has been removed from a package because there are sensors that can track that. And therefore, we can actually, for instance, warn that maybe after the second dose, the package has been out of range in terms of temperature, it was forgotten, it was left in the sun or whatever, and warn the patient not to use the remaining doses. So we're not throwing away the whole thing. We're basically providing companion data points as the doses are being removed for a multi-dose package, right? This is also cool for clinical trials, as you mentioned, for a lot of it is solid dose medication. But those medications are often titrated, sometimes temperature sensitive, and certainly time sensitive. So we've got the temperature, time, and access to each particular dose that we're storing on the package. So by analyzing that and identifying adherence patterns, we can basically feed this data back in proper form to enable healthcare providers to tailor interventions. And by understanding these patterns, these adherence patterns and package usage patterns, providers can offer personalized care plans and improve overall treatment outcomes. Or in terms of clinical research, of course, provide better research because, how can you study a drug if you don't know when and how a patient actually took the drug, right? So
100%. Absolutely.
Yeah.
And it's amazing too, because these are things we didn't have in the past. And now you can actually capture it. It makes me wonder why, is everybody doing this? I mean, we should be. It's amazing.
Yeah, I mean, imagine a patient just tapping their smartphone. We do like to combine these packages with the smartphone, because obviously, while you hear a lot about super duper technologies like printable displays and things of that, so they get really expensive and prone to failure. You really need as close to 100%, in terms of minimum 3 sigma, in terms of quality and performance of electronics when you're making them available for use in commercial settings, right? So the smartphone is actually a great companion to these smart packages. So we basically implemented by a patient tapping the smartphone just like they would when they're paying a restaurant bill to the package, and then getting all the right information at exactly that point in time. So they would get, depending on which app they're using, what detail of information and how it's being presented, they would get basically, a green check mark, everything is good to go. Or they would say, they get a little clock that says, please keep the medication outside the fridge for 7 more minutes until it's acclimatized. And then later on, they would, after they take it, they'd say, the app could collect information like, how do you feel, or whatever kind of side effects, and please don't forget to return the package to the fridge, right? Now, if they do forget to return it to the fridge, it would sure know the next time, right? In a week from now, if it's a weekly dose, for instance, right? It would know that it hadn't been returned to the fridge, in which case it would then say, actually, you can use this dose, but the additional doses are then going to be expired because they will have reached the, maximum exposure limits, and please go to your pharmacy or physician and retrieve a new package, right? So all these kind of things, I think, help ensure drug integrity, efficacy, and really patient safety by preventing the use of compromised medications.
It's fantastic, and all of that at the individual, at the person's fingertips. It makes it very, very easy to adhere and comply. So I think that's amazing. So in the last minute that we have, and as we close out, I would love to hear from you. How do you envision IMC's technology evolving in the next few years? And what impact could it have specifically on diabetes management, as well as things like telehealth that's playing a bigger role in this therapeutic area?
I touched on that a little bit. The kind of temperature analytics that we're doing right on the package, it probably would be nowadays touted as some sort of an AI play. We've been doing this since 2004. So it's really, we call it temperature tracking instead of temperature logging, for instance. So, but in the coming years, I think our technology is likely to integrate more advanced AI analytics as they become available and validated for healthcare use. We're trying not to make our devices be medical devices. We are supporting the usage of the drugs and the proper adherence to regimen, but we're not making therapeutic decisions at this point. I think that'll probably be done in third-party apps. Whether those third-party apps are done by us or another company, who knows? But these AI analytics and telehealth integration, enhancing remote monitoring capabilities, all this evolution could enable more predictive insights, maybe allow for more proactive diabetes management, and enhanced data integration into telehealth platforms can improve access to care and foster a more connected healthcare ecosystem. Well, one of the things that we've done is we've actually invested in a now unicorn called Huma out of UK, and they do virtual wards, they call it. They're big into telehealth. They've been installed in health systems that are already, have already enrolled and touching about 50 million patients. So we're hoping that as telehealth becomes more prominent, these ancillary type of digital wrappers will become more necessary, because what's the point of telehealth if you don't actually know what's inside the package and how it's been used, right?
Exactly. Well, Michael, thank you so much for these insights and the offerings that you have through IMC. It's amazing work, and I'm hoping that people will be reaching out to you, because the smart packaging, there's almost no excuse not to be using it these days.
Absolutely.
So congrats to you, and thank you so much. Have a wonderful, happy Halloween.
Oh, thank you, Amy. Same to you.